Hi, I'm Dr. Adrian Larsen, and today I'd like to talk to you about laser safety. We know that whenever we're using lasers, particularly with patients, we need to be careful about the eyes. Because laser light is coherent, that means it's very concentrated in one small space, and that can cause damage to the retina if you shine a laser in someone's eye for any extended period of time. Depending on the power of the laser, the time that it takes to do damage will be less. The more powerful the laser, the quicker of an exposure to light can cause damage to the eyes. Now, all the lasers we sell, our Chi Calm and our Chi Pulse lasers, are Class 3A lasers, which means they're generally considered eye safe. A quick exposure, you'll be safe because you'll either blink or you'll look away before there's any damage. However, that doesn't mean you can ever neglect laser safety. So today I want to give you a few tips for laser safety. First of all, there's a couple of things you need to remember about laser safety. There's direct exposure and reflected exposure. Direct exposure means what it sounds like, shining the light directly into the eye, and obviously you would never do that. If you're ever going to treat points on the face or around the eye, then you're going to be extremely careful, to the point of making sure that the eye is closed and held and covered if you're going to do anything on the face near that eye. On the other hand, reflected exposure, that one's a little bit harder to guard against. Let's suppose you're treating something down here and you accidentally flash off of a ring and that ring reflects, you can get a beam directly in the eye. That's why even when you're using lower powered lasers, it's a great idea to use laser safety glasses. Now there's a few things you need to know about laser safety glasses. It's actually a little bit technical, but I'll make it really clear. The bottom line is that laser light is always one specific wavelength. This laser I'm holding is a 635 nanometer wavelength. That means it's a red color. And so you want glasses that will allow light to pass through but block red. If no light passes through, obviously you can't see to do any work. So you want to let other colors in but keep the red out. And that's really easy to do. You just put a special coating on there that blocks red and lets other things through. The problem is that most laser safety glasses out there only block one wavelength. So you have a coating that blocks red, but the blue will get through. Or if you block blue, the red will get through. And nobody wants to have to keep changing glasses every time you use a different kind of laser. That's why we designed the Chi Safe laser safety glasses. These are really great because they're specially coated with two different coatings that will block both frequencies or both wavelengths of laser light. They'll block the red and they'll block the blue in one set of glasses, and they're really good looking. Okay, maybe they're not really good looking, but you and your patients will appreciate the fact that you're being careful about their safety when you're using lasers around them. I'd like to do a demonstration, show you exactly how they work. I'm going to set up my lasers here in a little stand. So we can see the red dot on the table, and when I block it with my hand, you can see the dot on my hand, but it goes away on the table. Obviously no light gets through my hand. Now we're going to do the same thing with the lens from the laser glasses. When I put it in front of the lens, you can see almost no light gets through. Just a tiny bit of the light is allowed to pass through. The red dot all but disappears. Now let's try the same thing and see how well it blocks the blue frequencies. So I'll turn it on. There's my blue dot on the table. And when I place the lens in place, you can see that there's no blue dot at all. No light gets through. You can see the blue dot on the lens of the glasses, but nothing gets through the glasses to the table. So it very effectively blocks both wavelengths. So one pair of glasses, both wavelengths of light, complete safety for you and your patients. That's why I recommend always using safety glasses, even if you don't feel you need to. It's always better safe than sorry. Till next time, be safe.